Question 1. In the context of radiation protection, Mr. Smith, a radiation safety officer at a medical facility, is conducting a routine inspection of the radiology department. During the inspection, he notices that several workers are using improper shielding materials, which might lead to unnecessary radiation exposure. According to safety protocols, what is the first step Mr. Smith should take to address this issue? A. Increase the time of exposure to balance the dose. B. Immediately report the issue to the regulatory authorities. C. Reassess the area's shielding requirements based on the type of radiation used. D. Recommend the workers wear additional personal protective equipment, PPE. Answer. Correct answer. C. Reassess the area's shielding requirements based on the type of radiation used. Explanation. The first step in such situations should be to reassess the shielding requirements according to the lower as low as reasonably achievable principle. It's crucial to ensure that radiation exposure is minimized through proper shielding. Each type of radiation, whether X-rays, gamma rays, or others, requires different shielding materials. For instance, lead is commonly used for gamma radiation, while concrete may be more effective for neutrons. The ALARA principle in the radiation safety regulations stress optimizing shielding first before using PPE or increasing exposure times. Reporting to authorities is necessary for ongoing issues but not the first step, resolving immediate hazards. Question 2. Which of the following is the most significant risk factor when considering the biological effects of radiation exposure on tissues? A. Linear energy transfer, length. B. Dose rate. C. Time of exposure. D. Type of radiation source. Answer. Correct answer. A. Linear energy transfer, length. Explanation. Linear energy transfer, length is a critical factor because it directly impacts the biological damage caused by radiation. High-level radiation, such as alpha particles, is more likely to cause severe damage to tissues due to the concentrated energy deposited in a small area. This leads to more significant biological effects, such as DNA strand breaks, which increase the risk. Deterministic effects, such as cancer, while dose rate, time of exposure, and the type of radiation source also play important roles, lead is often considered the most significant in terms of biological risk. Question 3. Given the circumstances, Mrs. Adams, a technician working in a nuclear medicine department, is assigned to perform a procedure using a radiopharmaceutical that emits both beta and gamma radiation. What is the most appropriate method to reduce her exposure to both types of radiation? A. Use only lead shielding for both beta and gamma radiation. B. Use a combination of lead shielding for gamma and plastic or acrylic shielding for beta radiation. C. Increase the distance from the radiopharmaceutical to reduce exposure. D. Limit exposure time, regardless of the type of radiation. Answer. Correct answer. B. Use a combination of lead shielding for gamma and plastic or acrylic shielding for beta radiation. Explanation. Beta radiation is typically stopped by materials such as plastic or acrylic, while gamma radiation requires denser materials like lead for effective shielding. Using both types of shielding ensures that both radiation types are effectively blocked. The ALARA principle emphasizes minimizing exposure through shielding, distance, and time. Increasing distance, option C, and limiting exposure time, option D, are also important, but they are secondary to using appropriate shielding for each radiation type. Question 4. What factors contribute to the potential for acute radiation syndrome (ARS) in a worker who has received an exposure of 500 millisieverts (MSV) from a radiation source? A. Dose rate and tissue sensitivity. B. Half-life of the radionuclide used. C. Electromagnetic spectrum of the radiation. D. The worker's age and medical history. Answer. Correct answer. A. Dose rate and tissue sensitivity. Explanation. ARS is most likely to occur when a significant dose of radiation is delivered in a short period, which is heavily influenced by the dose rate. Tissues that are more sensitive to radiation, such as bone, marrow, and gastrointestinal cells, are more likely to be affected. The half-life of the radionuclide, option B, is not directly related to the onset of ARS but affects the duration of exposure, while age and medical history, option D, may influence the severity of symptoms. Dose rate and tissue sensitivity are the primary factors in the development of ARS. Question 5. While analyzing a survey meter report in a radiology facility, you notice that the radiation level in a certain area exceeds the acceptable threshold. According to the radiation safety regulations, which of the following is the first action that should be taken? A. Increase the shielding in the area to meet the required standards. B. Restrict access to the area and notify the radiation safety officer (RO). C. Decrease the exposure time for workers in the area. D. Perform an immediate evacuation of the facility. Answer. Correct answer. B. Restrict access to the area and notify the radiation safety officer (RSO). Explanation. The first action should always be to restrict access to the area to prevent any further unnecessary exposure. After that, the RO should be notified immediately to assess the situation and implement corrective measures. While increasing shielding or decreasing exposure time might help reduce the radiation level, these steps should follow the immediate response of restricting access to prevent harm. Evacuation is typically a last resort and should only occur in extreme cases. Question 6. Which of the following best describes the stochastic effects of radiation exposure? A. They occur only above a certain threshold dose and have increasing severity with higher doses. B. They are deterministic effects that manifest immediately after a high dose of radiation. C. They have no threshold and the probability of occurrence increases with the dose. D. They are the immediate effects observed in cells such as erythema or hair loss. Answer. Correct answer. C. They have no threshold and the probability of occurrence increases with the dose. Explanation. Stochastic effects, such as cancer or genetic mutations, do not have a threshold and their likelihood of occurrence increases with the amount of radiation received. These effects are probabilistic, meaning that the higher the dose, the greater the chance of their manifestation, but the severity of the effects does not depend on the dose. This is in contrast deterministic effects, which do have a threshold and become more severe with higher doses. Question 7. In light of recent developments, a radiology technician is concerned about potential contamination from a radiopharmaceutical after administering a dose. Which of the following steps should be taken to minimize the risk of contamination? A. Ensure proper waste disposal procedures are followed for the radiopharmaceutical. B. Immediately clean the patient's skin using soap and water. C. Only wear gloves during the administration of the radiopharmaceutical. D. Increase the shielding for the patient during the procedure. Answer. Correct answer. A. Ensure proper waste disposal procedures are followed for the radiopharmaceutical. Explanation. To minimize the risk of contamination, the most important step is ensuring that proper waste disposal procedures are followed. This includes disposing of any contaminated materials, such as syringes, gloves, and vials, in designated radioactive waste containers. Cleaning the patient's skin, option B, may help in some cases, but not the primary method for handling contamination risks. Proper shielding for the patient, option D, does not address contamination, and wearing gloves alone, option C, is not sufficient for contamination control. Question 8. During the process of radiation detection, a technician is using a Geiger-Müller counter to measure radiation levels in laboratory. What is the most significant limitation of using this type of detector for radiation safety monitoring? A. It cannot detect alpha particles. B. It provides real-time quantitative data. C. It only detects gamma radiation. D. It does not provide information about the energy of the detected radiation. Answer. Correct answer. D. It does not provide information about the energy of the detected radiation. Explanation. One limitation of the Geiger-Müller counter is that it detects the presence of radiation but does not provide information on the energy levels of the radiation. While it is effective at detecting beta and gamma radiation, option is incorrect. It cannot give detailed energy spectrum, which is crucial for certain radiation safety assessments. Additionally, the counter provides real-time data. It is less accurate for precise quantification than other detectors, such as scintillation detectors. Question 9. Mr. Johnson, a radiation safety officer in a medical facility, is conducting a dose assessment for a diagnostic radiology procedure. Which of the following factors will have the greatest impact on the patient's effective dose? A. The type of imaging technique used. G. X-ray or CT scan. B. The patient's age and body size. C. The duration of the procedure. D. The energy level of the X-rays used. Answer. Correct answer A. The type of imaging technique used. T. X-ray or CT scan. Explanation. The type of imaging technique significantly influences the patient's effective dose. For example, a EKG typically delivers a much higher dose than a conventional X-ray due to the multiple rotations and higher energy involved. While factors like patient age and body size, option B, can affect dose, the imaging technique has the greatest impact. The energy level of X-rays, option D, also affects the dose, but to the lesser degree compared to the overall technique. Question 10. Which of the following best describes the primary function of the thermoluminescent dosimeter (TLD) in radiation safety? A. It measures the energy of gamma radiation. B. It records the radiation dose received by the body over time. C. It provides real-time radiation level readings in a given area. D. It detects radiation contamination on surfaces. Answer. Correct answer. B. It records the radiation dose received by the body over time. Explanation. Thermoluminescent dosimeters (TLDs) are primarily used to record the amount of radiation exposure a person receives over time. The device stores energy from the radiation and releases it as light when heated, which is then measured to determine the dose. TLDs do not provide real-time measurements, option C, or detect contamination, option. And while they can measure a variety of radiation types, their primary function is to assess cumulative dose rather than energy levels, option A. Question 11. In light of recent developments in nuclear safety training, Dr. Hassan, a radiation safety officer at a high-energy physics laboratory, is designing new protocols for monitoring neutron radiation exposure. He wants to ensure optimal use of detection systems to safeguard workers near particle accelerators. Which detector type should Dr. Hassan prioritize for its specificity and efficiency in detecting fast and thermal neutrons? A. Geiger-Müller counters. B. Sodium iodide scintillation detectors. C. Proportional counters with BF43 gas. D. Ionization chambers. Answer. Correct answer. C. Explanation. Proportional counters filled with BF43 gas are highly effective for detecting both thermal and fast neutrons due to their sensitivity and ability to discriminate neutron interactions. Geiger-Müller and scintillation detectors are not specific to neutrons, and ionization chambers are inefficient for neutron detection. SRP report No. 38 emphasizes the need for neutron-specific detection in high area. Question 12. The relationship between energy and attenuation is crucial for shielding design. Which of the following statements best describes how photon energy affects attenuation by a material? A. As photon energy increases, attenuation increases due to more frequent interactions. B. The attenuation is independent of photon energy and depends solely on material density. C. As photon energy increases, attenuation generally decreases due to lower interaction probability. D. High-energy photons are completely attenuated by thin lead sheets. Answer. Correct answer. C. Explanation. Higher energy photons have lower interaction probabilities, hence attenuation decreases with increasing energy. Shielding materials like lead need greater thickness for higher energy photons. This concept is governed by the exponential attenuation law and discussed in ICA publication 116 and NRP report No. 147. Question 13. During the process of calibrating a handheld radiation survey meter (MS), Valdez notices fluctuating readings when exposed to a known standard gamma source. Which action should she take first to ensure accurate calibration? A. Immediately replace the Geiger tube. B. Repeat the calibration in a different area with lower background radiation. C. Adjust the internal voltage to stabilize the readings. D. Verify the battery status and check for electronic noise interference. Answer. Correct answer. D. Explanation. Unstable readings are often due to low batteries or electronic noise. The first step should be to rule out these basic issues. If still unresolved, proceed with environmental and technical evaluations. NRC calibration guidelines emphasize battery and electronic integrity checks as first steps before adjustments. Question 14. Taking into account regulatory guidelines, which of the following radiation types requires the least shielding for effective attenuation in a controlled laboratory environment? A. Neutrons from a sealed source. B. High-energy gamma rays from A192. C. Alpha particles from a plutonium source. D. Beta particles from a Laurenti source. Answer. Correct answer, C. Explanation. Alpha particles have low penetration and can be shielded by paper or skin. Unlike neutrons or gamma rays that need dense or specialized materials, alpha particles pose mainly internal hazards. As per an RP report note 32, containment is prioritized over shielding for alpha emitters. Question 15. Under the assumption that a nuclear medicine facility is disposing of I-131 waste, what is the most appropriate method to manage the radioactive waste considering its physical and biological half-lives? A. Immediate burial in a classer, low-level waste disposal site. B. Long-term storage for decay and storage until levels are indistinguishable from background. C. Release to the environment via liquid waste systems. D. Neutralization using chemical processes before disposal. Answer. Correct answer, B. Explanation. Decay and storage is suitable for I-131 due to its 8-day half-life. Waste is stored until radiation is indistinguishable from background, per NRC Regulation 10 CFR 35.92. Burial is reserved for long-lived isotopes and environmental release is tightly controlled and rarely appropriate. Question 16. In a context of radiation accidents, Mr. Cheng is tasked with planning the emergency response for a facility using sealed gamma sources. What should be the first action in the event of a suspected source breach? A. Evacuate the building and alert emergency responders. B. Secure the area and attempt to remove the source manually. C. Enter the room with dosimeter and PPE to confirm contamination. D. Notify the RIO and implement the facility's radiation emergency protocol. Answer. Correct answer, D. Explanation. The Radiation Safety Officer RSO ordinates emergency actions per NRC guidelines and 10 CFR 20.2202. Immediate implementation of the Radiation Emergency Protocol ensures safety and compliance. Manual intervention without assessment increases risk and violates ALARA principles. Question 17. Throughout the course of long-term occupational monitoring, what is the most appropriate device for accurately assessing cumulative whole-body radiation dose over months? A. Ionization chamber. B. Thermoluminescent dosimeter TLD. C. Geiger molar survey meter. D. Liquid scintillation counter. Answer. Correct answer, B. Explanation. ELDS are ideal for long-term cumulative monitoring as they store absorbed dose data and can be read retrospectively. They offer good sensitivity and tissue equivalence. Geiger counters and ion chambers are for immediate readings. Refer to NRC Regulatory Guide 8.34 for TLD US standards. Question 18. What factors contribute to increased relative biological effectiveness RBE of radiation types like alpha particles compared to gamma rays? A. Alpha particles travel faster, depositing energy uniformly. B. Gamma rays cause more direct DNA damage. C. Alpha particles have higher linear energy transfer leading to dense ionization. D. Gamma rays have higher charge and interact strongly with cellular molecules. Answer. Correct answer, C. Explanation. Alpha particles have high LET, causing dense ionizations over short distances, increasing biological damage, and LB gamma rays have low LET, producing sparse ionizations. As per ECHA publication 103, RBE correlates with LET and is a critical factor in radiation protection and risk modeling. Question 19. Mr. Alston, working in an industrial radiography setting, encounters a malfunctioning collimator that potentially exposes the primary beamer outside the intended direction. What is the most critical step he should take immediately? A. Continue the procedure while shielding the stray beam with additional lead. B. Inform the supervising radiologist for authorization to proceed. C. Cease operations and report the equipment for immediate inspection and lockout. D. Realign the source manually to correct the collimation angle. Answer. Correct answer, C. Explanation. Any suspected equipment malfunction that poses A radiation risk requires immediate cessation of work. Lockout-tagout procedures must be followed. This aligns with ANSI M.10 and NRC guidelines for industrial radiography, prioritizing worker and public safety. Question 20. In what ways can dose fractionation influence the biological response to radiation in therapeutic or accidental exposures? A. It increases the damage due to cumulative effects. B. It allows normal tissues time to repair, reducing side effects. C. It leads to higher LET, increasing biological damage. D. It reduces oxygenation, making tissues more radiosensitive. Answer. Correct answer, B. Explanation. Dose fractionation enables normal cells to repair suboptimal damage, enhancing therapeutic ratios in radiation therapy and mitigating deterministic effects. This concept is a foundation of radiobiology and is supported by ICRU Report 62 and ICUP 103. Question 21. Which of the following safety practices is recommended to reduce the likelihood of radiation exposure to healthcare workers during the handling of radiopharmaceuticals? A. Use of lead aprons for personnel handling radiopharmaceuticals. B. Restricting the handling of radiopharmaceuticals to shielded cabinets or hot cells. C. Wearing radiation dosimeters only when working with high-energy gamma sources. D. Providing thyroid collars for all personnel handling radiopharmaceuticals. Answer. Correct answer, B. Explanation. Shielded cabinets or hot cells are essential for containing radiation during handling and reducing exposure, while lead aprons and dosimeters are important. Isolating radiopharmaceuticals in these shielded areas is the most effective practice. This is in line with NRC CFR Part 20, ensuring ALARA compliance. Question 22. Dr. Young is performing an iodine 131 treatment for a thyroid cancer patient. Which of the following is the most critical aspect of radiation safety to ensure patient and public protection post-treatment? A. Verifying the patient's medical history for iodine allergies. B. Ensuring the patient receives adequate hydration before and after treatment. C. Maintaining a distance from the patient for at least 24 hours post-treatment. D. Advising the patient to avoid any physical activity for a week after treatment. Answer. Correct answer, C. Explanation. After iodine 131 treatment, the patient emits significant radiation, requiring increased precautions for both themselves and others. Maintaining distance as per NRC guidelines minimizes exposure to radiation. Hydration is also important, but not the most critical factor for radiation protection. Question 23. When monitoring radiation exposure in a nuclear medicine facility, which of the following dosimeters is most suitable for measuring radiation exposure over a longer duration, weeks to months? A. Pocket ionization chamber. B. Thermoluminescent dosimeter, TLD. C. Optically stimulated luminescence dosimeter, OSCILD. D. Film batch dosimeter. Answer. Correct answer, B. Explanation. Thermoluminescent dosimeters, TLDs, are ideal for monitoring cumulative dose over time because they can store and later release the absorbed dose. TLDs are highly sensitive and their readings are reliable for longer periods. OSCILDs also work well, but TLDs are preferred for their durability and wide use in nuclear medicine. Question 24. In the event of a radiation emergency involving radioactive material, the first action the emergency response team should take is to A. Evacuate all personnel from the area immediately. B. Begin decontamination of the area. C. Notify the radiation safety officer and emergency responders. D. Close off ventilation systems to prevent contamination spread. Answer. Correct answer, C. Explanation. The first action is to notify the radiation safety officer or and emergency responders to initiate appropriate procedures and provide expert guidance. Evacuation and decontamination are important but should follow after proper communication and assessment. This ensures the response is coordinated and compliant with emergency response plans NRC EFR 20.2202. Question 25. When designing a shielding system for a high-energy photon source in a medical facility, which of the following materials would be most effective for attenuating the radiation? A. Steel. B. Concrete. C. Lead. D. Water. Answer. Correct answer. B. Explanation. Concrete is widely used for shielding against high-energy photon sources due to its availability, cost-effectiveness, and relatively high atomic number. Lead is effective for lower energy radiation, but not as effective at higher photon energies. Steel and water are generally less effective than concrete for photon attenuation. Question 26. In a scenario where a nuclear medicine facility is disposing of low-level radioactive waste, what is the primary regulatory requirement for ensuring proper waste management? A. Secure long-term storage in a remote facility. B. Decay and storage until radiation levels reach background levels. C. Incineration followed by disposal in standard landfills. D. Reprocessing the waste for reuse in medical treatments. Answer. Correct answer. B. Explanation. Decay and storage is the most appropriate method for low-level radioactive waste disposal in facilities handling radiopharmaceuticals. Waste is stored until its radioactivity decays to background levels. This process is compliant with NRC Regulation 10 CFR 35.92. Secure storage and decay, rather than incineration or reprocessing, are preferred for waste management. Question 27. Which of the following best describes the significance of the concept ALARA in radiation safety? A. ALARA is a principle applied to radiation dose limits, ensuring they are as high as legally possible. B. ALARA refers to the process of monitoring radiation exposure without making adjustments to working practices. C. ALARA involves minimizing radiation exposure to workers and the public while maintaining the intended clinical benefit. D. ALARA requires the use of lead shielding in all instances, regardless of the exposure level. Answer. Correct answer. C. Explanation. The ALARA, as low as reasonably achievable, principle is foundational to radiation protection, aiming to minimize exposure while maintaining practical benefits. It involves utilizing appropriate safety measures, procedures, and equipment to reduce radiation exposure to the lowest possible level while still achieving clinical goals. SRP Report No. 116. Question 20. In the context of occupational radiation protection, the main purpose of a control area is to A. Isolate areas where radiation doses can exceed regulatory limits. B. Contain radioactive waste material during disposal processes. C. Prevent access to high-risk areas for untrained personnel. D. Provide a backup location in case of equipment failure. Answer. Correct answer. C. Explanation. A control area is designated to limit access to workers trained in radiation safety, and it is essential for ensuring that radiation exposure remains within safe limits. This area allows for controlled access and monitoring, as outlined by NRC EFR 20.1003. Question 29. Which type of radiation monitoring device would be most appropriate for measuring exposure to beta particles in a clinical radiation therapy setting? A. Geiger-Müller counter. B. Scintillation counter. C. Thermoluminescent dosimeter TLD. D. Solid-state dosimeter. Answer. Correct answer. B. Explanation. Scintillation counters are highly effective for detecting beta radiation because they produce visible light when interacting with beta particles, allowing for sensitive detection. TRDS are suitable for cumulative dose monitoring, but scintillation counters are preferred for beta particle exposure measurement in clinical settings. Question 30. When performing radiation protection calculations, the highest dose rate to the skin is most often associated with which of the following radiation types? A. X-rays from diagnostic imaging. B. Alpha particles from sealed sources. C. Beta particles from radiopharmaceuticals. D. Gamma radiation from external sources. Answer. Correct answer. D. Explanation. Gamma radiation is highly penetrating and can lead to higher dose rates to the skin, especially if the source is external. Alpha and beta particles, while biologically impactful, generally have lower penetration, with alpha particles being stopped by the skin. The SRP report No. 160 outlines dose calculations for various radiation types.